Augmented reality, virtual reality, and mixed reality, AR, VR, and MR in healthcare by Fardeen Kasi. Welcome to the future of healthcare, where technology is not just an accessory, but a vital partner in saving lives and enhancing care. Today, we are exploring the transformative impact of AR, VR, and mixed reality in healthcare. These technologies are not only reshaping how we approach treatment and training, but also opening new doors to innovation and accessibility. Augmented reality AR in healthcare. Let's start with AR. AR overlays digital information onto the real world, creating an interactive environment where virtual objects blend seamlessly with physical settings. One of AR's most impressive applications is in surgical assistance. Surgeons can use AR devices like the Microsoft HoloLens to overlay 3D visuals of a patient's anatomy or real-time vitals onto their body during operations. This enhances precision and reduces the risk of errors. In-vein visualization tools like AccuVein project a map of veins directly onto the patient's skin, making blood draws and IV insertions easier and less stressful for both patients and healthcare providers. AR is also transforming medical education. Medical students and professionals can study 3D models of organs and systems in detail, allowing them to practice and learn without relying solely on cadavers. Additionally, AR helps in patient education by projecting virtual representation of conditions or treatments, making complex medical concepts easier to understand. Virtual reality VR in healthcare. Moving on to virtual reality, VR immerses user in completely virtual environment, offering transformating possibilities in therapy, training, and rehabilitation. In pain management, VR is being used to distract patients from discomfort during procedures or treatments. By immersing them in calming environments such as beach or forest, VR can significantly reduce perceived pain. This approach is particularly effective for burn victims during dressing changes or for cancer patients undergoing chemotherapy. VR has a growing role in mental health therapy. Through exposure therapy, it creates controlled environments to help treat conditions like PTSD, anxiety, and phobias. Patients can convert fear or triggers in a safe and monitored setting, achieving gradual desensitization. For physical rehabilitation, VR offers gamified exercises that engage patients recovering from strokes or surgeries. Platforms like MindMotion and Reflection Health motivates patients to perform exercises correctly, improving motor skills and speeding up recovery. In medical training, VR allows healthcare professionals to practice surgical procedures or emergency responses in a risk-free virtual environment, helping them refine their skills before applying them in real-world scenarios. Mixed reality MR in healthcare. Finally, we have mixed reality MR, which combines the physical and digital worlds, enabling real-time interaction with both. One of MR's standout applications is in preoperative planning. Surgeons can use MR to interact with 3D holograms of a patient's organ or tissues, studying them in detail to plan complex surgeries. This approach minimizes uncertainties and improves outcomes. MR is also facilitating remote collaboration in healthcare. Teams from different locations can simultaneously work on a 3D shared model, enabling real-time discussions and treatment planning. Imagine a team of radiologists examining a virtual tumor model together, regardless of their physical locations. In assistive technology, MR supports the development of tools for patients with disabilities, such as MR-integrated prosthetics or rehabilitation platforms that provide real-time feedback. Examples of AR, VR, and MR applications. Here are some real-world applications of these technologies. AR for surgery. AR assistant platforms like ProPrio enhances neurosurgery by overlaying imaging data onto the surgical site. VR for therapy. Cedars-Sinai uses VR for chronic pain management, immersing patients in soothing virtual environments. MR for collaborations. Philips Azurion platform integrates MR to assist in image-guided procedures, improving accuracy and efficiency. Let's look at a comparison of AR, VR, and MR in healthcare. From the perspective of immersion level, AR enhances real world, while virtual reality fully immersive virtual world environment. The mixed reality combines real and virtual world. In terms of user interaction, AR interacts with real objects, VR interacts in a virtual space, while MR interacts with both real and virtual objects. Applications: for AR, it's surgical assistance, vein visualizations. For VR, it's therapy, training, rehabilitation. For MR, it's preoperative planning, remote collaboration. The hardware: AR utilizes AR glasses, smartphones. VR looks for VR headsets. And we have MR headsets such as HoloLens for mixed reality. AR enhances the real world, VR immerses the user in a virtual world, while MR bridges the gap between the two, creating seamless integration. What are the challenges of AR, VR, and MR in healthcare? While these technologies are promising, they face several challenges. Cost: high hardware and software costs limit widespread adoption, especially in underfunded healthcare systems. Training needs: medical professionals require extensive training to use these tools effectively. Interoperability: many platforms lack compatibility with existing healthcare systems, making integration complex. Privacy concerns: the collection and use of patient data in these technologies raises significant security and data privacy issues. The future outlook: the future of AR, VR, and MR in healthcare is bright. Advancements in AI integration will provide more personalized and predictive insights. 5G and 6G connectivity will enhance real-time performance, especially for remote applications. As manufacturing evolves, costs are expected to decrease, making these technologies more accessible. Importantly, broader adoption in rural and underserved areas could help bridge healthcare gaps, offering equitable care worldwide. In conclusion, AR, VR, and MR are not just innovations but life-saving tools. They are transforming surgical precision, patient care, medical education, and rehabilitation. While challenges remain, the potential for these technologies to revolutionize healthcare is undeniable. Thank you.